Hi, everyone. Welcome to the Trial Site News Podcast. I'm Dr. Erin, your host. And today we have a very special guest, Achal Prabhala. Thank you so much for joining us today.
Thank you, Erin. I'm glad to be here.
And for our listeners, because I like to tell you guys what the show is going to be about, we're going to talk about the COVID-19 vaccines getting to other countries. Right now, we hear a lot about, boosters and the fight over vaccine mandates in rich countries, but what's going on in poor countries? Are they getting the vaccines? Right now, from last I read, less than 1% of people in low-income countries are vaccinated. And, here in the States where I live, a wealthy country, we're all fighting over boosters and whatnot. And I know our viewers have strong opinions about the vaccines, and I hear you guys, but I just wanted to give you a heads up about that. This is what we're focusing on for this particular episode. So hopefully you stick around. And Achal, with that said, do you mind telling our viewers a little bit about you and what you do?
Yes, Erin, absolutely. I'm Achal Prabhala. I live and work out of Bangalore in South India. It's very important that this is South India, by the way, because we're quite chauvinistic about that. I've lived here all my life, but I work in this country, in India, as well as South Africa and Brazil. I've spent different points of my life living and working there full time, and I work across all of these three countries. I primarily work on access to medicines for the last 20 years. This is what I've been doing. And what I look at are primarily pharmaceutical monopolies and how we can dismantle them, because they're fundamentally unjust. And the short version of their effect over the last 30 years in the world has been that they lead to death and destruction. In the pandemic, over the last 18 months or so, I've worked almost full time on access to vaccines, which is ironic because 9 of the months I worked on this issue, we didn't have vaccines, which would assume in some sense that once vaccines came, the situation would be better, but it has astonishingly only become a little more cruel once vaccines actually existed, because then we had something that could vastly mitigate the effects of COVID, not just individual lives, but actually how whole societies function again.
So I've read a lot of what you've written, some of your quotes in the mainstream media. I particularly liked the piece that you wrote with Chelsea Clinton in The Atlantic, and it was titled, "Biden has the power to vaccinate the world." So what did you mean by that? And do you still feel the same way?
Very much, Erin. Thank you firstly for reading these pieces. I think that none of them are cheerful, and everything I've had to work on, unfortunately, is just so cheerless that I almost feel sorry to have to ask people to read it and pay some attention to it. But that's been my reality and is the reality for the majority of the world. Biden does have the power to vaccinate the world. He had that power right through. The troubling thing is that, of course, your previous president, Trump, had that power too. It's just that he signed it away. And by that, I mean, it's not just that he did not bother to consider vaccinating the world, but actively signed that away. And he did that in a couple of ways. One, when Operation Warp Speed, as well as the other branches of the US government, were funding and supporting new treatments and vaccines in an unprecedented way with huge amounts of money, they actively agreed with the pharmaceutical companies they were funding not to interfere anyway in setting prices or dictating access terms or in other ways interfering with what kind of control these pharmaceutical companies would have eventually over the treatments and vaccines that they developed. So it was actively signed away rather than merely neglected. But Biden still has the power to correct that situation. So even though more direct control was signed away in these contracts with pharmaceutical companies, the US still has a constitution, and those constitutions have laws attached to them that have meaning. And among the various means at the White House's disposal are laws that allow the US government to take control of private property such as patents and rearrange them as they wish, as well as to use elements of things such as the Defense Production Act, which is a relic of the Korean War from the mid-20th century, which allows the US government to set priorities for what US firms should do in the national interest. So to the extent that it is in the US government's interest to vaccinate the continent of Africa or the country of India, they can actually exert significant legal authority over the way private corporations within the United States behave through that act. And they've done this before. It's a very secretive act because it relates primarily to defense supplies. And so there's very little information on how it's been used, but there are several pieces on the record that allow us to deduce that it has been used to supply allies, for instance, with defense equipment. So it's been used to benefit foreign countries when that's in the US government interest to do so. Now, these are legal means. They're complicated, obviously, because all of them involve the possibility of disputes and various kinds of arrangements that have to be struck, even within the legal system. But the fact is that Biden actually has a moral power as the person in charge of the White House, and in fact used this moral power really early into his administration. So one of the first things that the White House did 3 months into Biden's term was to call Merck, a pharmaceutical company that did not have a vaccine and had actually abandoned its vaccine efforts by this point, to say, look, we have another company that we funded entirely. We funded its research and development entirely to the tune of a little over $1 billion. It's called Johnson & Johnson. They have a viable vaccine. It seems they can't make enough of it. We need more of it. So Johnson & Johnson, please meet Merck. We want you to allow Merck to make your vaccine because you can't make enough. Johnson & Johnson dug its heels in, kicked and shouted and protested a little bit. But the White House said, oh yeah, and by the way, we probably have the legal resources to make you do this because that's in our laws. And in any case, we'd like you to do this very much. And guess what happened? They agreed to cooperate and share their technology and their licensing and their intellectual property with Merck in order to make this happen. Now, that hasn't actually resulted in more Johnson & Johnson vaccines, I should just say. But what it shows is that the White House has a couple of different tools at its disposal. So one is the blunt force of legal pressure through the law, right? But there are other ways in which having the White House want something to be done invariably gets it done. The fact, I think, that rankles today is that the White House has not even attempted to do this with companies such as Moderna, again, which it funded to the tune of $1 billion, and by Moderna's own admission, covered every cent of their research and development, to companies such as Johnson & Johnson, where it did the same, or actually even to Pfizer, where its pre-orders of vaccine doses, because they're so high and at such a profit guaranteeing price, means that Pfizer on its vaccine alone is set to clock $35 billion in revenue for one single pharmaceutical product, right? This has never happened in history. The White House has significant pressure over every pharmaceutical company that operates within the country to get them to do a lot more than they're doing. The fact that it hasn't used that power means in some way that the White House at the moment is not serious about vaccinating the world.
Achal, thank you for that. If I remember correctly, the administration made some sort of statement a few months ago that they supported the waiving of intellectual property rights. But you said it in the earlier part of this podcast, and you've been working with lots of different countries, and you said it's only gotten worse. So there's no progress being made here in any way in terms of getting, vaccines to low-income countries.
It's certainly got worse overall, but I should say that in this one instance, in the case of the US administration's support of the TRIPS waiver, which, by the way, is a waiver of pharmaceutical monopolies worldwide, which are governed through an obscure trade rule at the World Trade Organization. So the World Trade Organization is a multilateral organization. It's part of the UN system. So they can't actually make laws. But what they do is they set rules, and those rules are sort of non-negotiable. If you are a relatively lightweight institution like UNESCO, they can have rules, but nobody cares about those rules because violating them has no consequence. To violate a WTO rule means your ability to trade is in jeopardy, which essentially means your ability to exist is in jeopardy. So they are very consequential, and they govern the way in which these pharmaceutical monopolies are mandated worldwide. They mandated it, literally. South Africa and India put a joint proposal together, supported by a majority of the world, literally something close to now between 70 and 100 developing countries across the world, out of 165 in total, actively want this to happen, to suspend pharmaceutical monopolies during the pandemic for a short period afterwards, a reasonable period of time, to allow people to make as many of the treatments and diagnostics and vaccines as necessary. Until March, this was proposed last year in October 2020, but until May of this year, when the Biden administration finally signaled support for it, there was absolutely no movement whatsoever. The funny thing was, despite a majority of the world wanting something at a membership organization, which you might believe should function on the basis of what the majority of its members want, the WTO, the World Trade Organization, could not even begin discussing it. The Biden administration's support of it actually changed the course of that TRIPS waiver, because it was the first government to come out and say that they did support it and that they would like to see it happen, which genuinely gave it a new life. And that new life continues today. And so there are things happening there. It was a positive step, and I don't want to throw that in with the other actions, which I think haven't been quite as meaningful. However, since that time, the Biden administration has not done anything further to reiterate its commitment to a TRIPS waiver or begin negotiating one, because these things need to be put into text. They need to be put on a page. They need to be voted upon. They need to be ratified. There's a lot that needs to happen, and not much movement has been seen from the US Trade Representative's office since that time, and that is worrying. Every other thing that the Biden administration has done, unfortunately, around vaccine access has been a mixture of hot air and empty promises. The hot air is, we want to vaccinate the world, which is unquestionably hot air because there are a series of very clear actions that we just discussed that could have been taken, which they've shown no signs of taking. The empty promises are vaccine donations, and vaccine donations are a really tricky thing because they are good if those vaccines exist today to be shipped to a country that needs them and doesn't have any, so they're good. And there are tens of millions of these vaccine doses that have been sent so far. Not a lot, but tens of millions, right? The problem is that we're looking at a solution for having 11 billion vaccines, which is what we need for the world, by donating tens of millions of vaccines. So it's not a solution. It's not going to get us to what we want. Donations are not going to work. They're not enough. It is a way, however, by which the White House can be seen as doing something positive. And depending on the level of laziness of the journalism around those announcements, it's either seen as this amazing effort that will save the world, or sometimes, very rarely, for what it is, which is a good effort, but far too little in the face of a storm.
I read some surveys over here. They're saying, oh, most Americans are against vaccines being made in other countries. And these surveys were the questions I would call biased. And I'm sure you've heard this. The biggest thing, oh, it wouldn't be safe to make these vaccines anywhere else. The quality would be lower. You have to worry about counterfeit vaccines. What are your thoughts on that?
This is a really infuriating thing for me personally. And I live in India, I work in South Africa and Brazil. I've spent the majority of my life in countries that don't have the same income as the United States. I was educated in the United States. I work with a lot of American colleagues, so I am aware, I think, of American realities. It's a peculiar kind of nationalism, perhaps, or short-sightedness, where even some American activists that I work with in public health don't actually say so quite as explicitly. I'm sometimes grateful when people just come out and say what they're thinking, right? To say, hey, obviously, American vaccines are the best. Any vaccine from outside is going to be rubbish and will kill you. And I actually appreciate that, because there are many people who are saying that without those words, who think that, and you can see that they think that, but they're just too politically correct to say it. And so there are ways that they get around that. I am incredibly frustrated by it because we live in a country here in India at the moment, which has the world's single largest vaccine manufacturer by volume, and about 25 other companies who make biologics and vaccines on a regular basis in very large volumes, who export them to several countries, including the United States. India is not such a great market for pharmaceuticals. A majority of the companies who operate out of here or other countries like us, Brazil, Turkey, China, South Africa, all of these countries look to Europe and the United States as markets to sell their products. Many of them are doing outsourced work for exactly the same pharmaceutical companies based in New Jersey and Basel and wherever else they exist. So it's always been a very integrated economy. Many of the pills that you take there are actually made here. Some of them, it isn't so clear that they're made here. Some of them, it's very clear that they're made here, right? So the market for medicines in the United States and in Europe is already very global. It's just that this is not something every single person understands. And I think what the Western pharmaceutical industry has done, and this is genuinely a stroke of genius, I think, is to stoke this kind of fear in people, which is unless you buy a Pfizer product with our logo from us in America, you're going to die. And this is something that has been going on literally ever since I started working on this issue, which was in 1999, when medicines for HIV and AIDS, antiretrovirals, were the COVID vaccine of that day. When they were completely unavailable, completely unaffordable, it was a slightly different problem. They were technically available. They were just available at such an insanely inflated price at about $10,000 a year per person. Absolutely nobody in sub-Saharan Africa could afford them. Very few people in India could afford them. And these were exactly the same kinds of concerns at that time, which were amplified around the world, which is, oh, yes, some Indian companies say that they can make these drugs at $350 a year, but do you really want to die? And in effect, that's the same thing that's being said today. The majority of the world gets vaccines. I've worked on vaccines that are being produced in Russia, in China, in India, in a range of other countries. There are vaccine manufacturing units in Africa, in Senegal, in Egypt. They have been making vaccines for decades. They're supported by the US government, by the European Union. It is so funny to think that people believe that vaccines are this kind of incredibly special magic that no one can make because we've been making them for decades. It's ludicrous. It's short-sighted and it's ludicrous. It's anachronistic and it's just harmful, finally, even I think to people within the United States, because these kinds of beliefs, where they end up is to concentrate an already highly monopolized pharmaceutical industry, right? So on top of all of the legal monopolies that the pharmaceutical industry has in the West, the one thing that they don't have is this unshakable will of the people and their trust. And if they had that to a great extent, that would absolutely jeopardize ordinary Americans and Europeans' ability to access the life-saving drugs and vaccines they need when they could be at a much lower cost.
Thank you. And as I was listening to you, it's just snobbery. It's a form of scientific snobbery. And Americans, do you hear that? A lot of your drugs that you're taking, not made in America. Maybe it'll sink in. I think it's just a lack of exposure, but you're so right. When you instill that fear, I mean, that's powerful. When oh, it won't be safe, so don't put that in your body. That's very powerful and inaccurate. I wanted to ask you about Russia's vaccine. I know it hasn't been authorized by the World Health Organization. However, lots of countries are using it. And my understanding is that they licensed it to manufacturers in India, maybe Brazil, I'm not sure. But they're making this vaccine, which is a viral vector vaccine, which is the same as the J&J vaccine. So same technology, essentially. How's it going? Is it working out?
This is a really interesting question, Erin, and I'm glad you asked me, because I think at different points in the pandemic, I've had different opinions on the Russian vaccine based on where they were at. When Russia first put out news of its vaccine widely, it was the beginning of this year, and it made a lot of news, in part because there was an impression that Russia had immorally tested it within Russia prior to being fully approved for safety and efficacy. So that wasn't actually quite true. And the truth was a little more complex, which is that both China and Russia, they had emergencies, they had these vaccines that they could have used. And what they did after confirming safety of the vaccine is that they enrolled a large number of people in a kind of large-scale phase 3 trial. So the difference between what China and Russia did in comparison to what the United States did, the United States waited until interim results, not, of course, the entire results, but interim results from phase 3 trials on efficacy came in prior to providing an emergency use authorization for the Pfizer, Moderna, the J&J shots, right? And what Russia and China did is prior to the commencement of phase 3 results to allow for a slightly larger amount of people within their countries to be vaccinated on the basis that they had a safe vaccine and could use the people being vaccinated as part of the trial around establishing efficacy and completing a full phase 3 process. So there was actually just a slight grade of difference between what happened there and what happened in the United States. But because these vaccines were being administered in countries like China and Russia, it caused a lot of controversy. And in fact, Fauci, among other people, weighed in and said, oh, you know, if we wanted to do that in America, we could have done that 3 months ago. And in part, this was because it was a kind of bizarre Cold War fight. It was Russian strongman, autocrat, Putin, who was saying, we are the first to bring a vaccine to the market, because it was, I think, technically on his count, 2 months before the approval for the Pfizer and Moderna vaccines came through. And I think it was the United States way of hitting back to say, actually, we're still on top and we're still better. And they were, of course, more in the right than Russia was on that score, but it was still a really ridiculous kind of standoff. I mean, meaning, I think that was the subtext. I grew up in a country which was on the non-US side of the Cold War and in the Cold War. And so I feel that very much. But that was definitely the subtext there, which I'm sure many people missed, especially younger people who missed the Cold War, is the Cold War. And then what happened in the months between January, February, and March is that several countries around the world struck deals to obtain the Sputnik vaccine. They also gave approvals to the Sputnik vaccine. Some countries like India actually ran extensive in-country trials on the basis of which they approved the vaccine. It came with high efficacy. It was a double-dose adenoviral vector vaccine, but the peculiarity of it was that each dose was different. So the first dose used the Ad26 vector, the second dose used the Ad5 vector. Like you said, that's exactly like the Johnson & Johnson vaccine with a twist, meaning that they were slightly different vectors in both vaccines. Now, what happened actually since that time is that they've run into a production problem. So all of the things that I think people believed was wrong about the Sputnik vaccine, that they were fudging efficacy numbers, that it didn't actually work. There was an issue in Brazil about possible contamination of live viruses in the sample batches that had been sent to Brazil for testing. It turns out that none of those issues were actually the issue with the vaccine. So until about 2 months ago, it was as good a vaccine as it looked like about 6 months ago. However, what happened in the last 2 months is that a clutch of Indian companies, about 8 different companies in India, were about to bring the vaccine to market in huge quantities, about 100 million doses a month. But what they found was that the production process to manufacture the second dose, the Ad5 vector, didn't work, meaning that it provided very low yields of the Ad5 vector, which meant that for every 10 doses they were making of the Ad26 vector, they were only able to get less than 1 dose of the second Ad5 vector dose, which meant that they didn't have a vaccine. And this is a huge problem. And so I do think that this is something that the Russian Direct Investment Fund, the Russian Sovereign Wealth Fund, and the Gamaleya Institute, which co-manage the vaccine, they needed to have done better on right from the start, and they need to fix now. One of the ways in which they're trying to fix it is to seek approval, which they're doing in India, for a single dose shot of the vaccine, which they're calling Sputnik Light. So the Ad26 vector, the first dose they can make, they are running phase 2-3 trials on that dose right now. And if they receive approval for it, we'll still have a slightly less efficacious dose of a single dose Sputnik vaccine. which is fine, but they should have acknowledged these missteps earlier. They should have figured it out. They did not. So while their supplies of vaccine remain fairly low because no one can actually make very large quantities of it, what they did do, which is again something I think they should be commended for, is set up an open source network of manufacturers. So essentially their position was, hey, we're the RDIF and Gamaleya, we're Russia, we have this vaccine, anyone who wants to make it, come to us. If you're a qualified manufacturer, you'll get a license. Now these licenses, no, they didn't pay them anything, it was at risk. So it's companies across the world, it's 34 companies actually around the world. So that's India, Argentina, China, there are places in Europe, there are German contract manufacturers who have taken up a license to make this vaccine. They do it at risk, but with technical assistance and a full support from the Gamaleya Institute. And their model is really wonderful. It is an incredible pity that the vaccine itself cannot be made in its current form. But the model that they developed was wonderful. And one of the things we're trying to do here is to say, look, India was depending on these 600 million doses to come in to vaccinate our own population. So just to vaccinate adults in India, we need something like 1.6 billion doses. We have only about 800. And so we're way short. We were depending on the Sputnik vaccine to come. And one of the things that I'm working on now is to pressure the White House into saying, release J&J. It's the same vaccine. We have a sort of proof of concept. We have 34 companies around the world who spent the last year making an Ad26 viral vector vaccine, which works, right? They can do the same on another process for J&J very, very easily. And so, yeah, that's where we're at. It's a complicated story, but I do feel it's an interesting story because there are plus points and minus points that are absolutely unclear, I think, to the casual observer on this journey of the Sputnik vaccine.
That's very interesting. I wanted to ask you about early treatment and this somewhat related to vaccines. There's a lot of chatter over here. People want to have access to early treatment drugs. And I know some things they say work, some things they say don't work. But since you've worked with a bunch of different countries, what is your opinion on that? And are people asking for it? Are they getting early treatment medications? Are they trying anything just because they don't have a vaccine at this point?
I should just begin by saying that this is not the subject I've focused most on. So I know the least about this. What I do know about, I think, are the situations around patents and monopolies on a couple of the drugs that seem to work at different points, like remdesivir really early on in the pandemic. I'm interested in the Merck's miracle COVID drug, molnupiravir right now, which is in a situation that is quite similar, meaning that it is a patented drug that promises to actually work, perhaps rather than remdesivir, which proved to have a very, very small effect. What I did notice during the pandemic is in India, for sure, and I can't say with as much certainty for other countries because my own geographical scope has been vastly curtailed physically by being here through the pandemic, is that there was possible over-medication. I think that these treatments were very zealously given out to people. My own father got COVID last year in July, and I do remember myself inquiring about a range of treatments at that time that seemed like possibilities. We had very judicious doctors who said that his condition did not warrant any kind of treatment whatsoever. And he was lucky, both physically and personally, as well as to have a judicious set of people advising him who applied common sense and good logic. I have heard stories of people being sent out on these impossible treasure hunts, people spending days and weeks looking for supplies of remdesivir or something else called amphotericin B, which was used to treat something called black fungus, which arose as a peculiarly Indian problem of the pandemic, in part due to over-medication through antivirals. It's been hypothesized. And one of the striking features of this pandemic, the second wave especially, is these stories of people who doctors and hospitals have said, look, your mother, your father, your brother, cousin is sick, is bad, you need to get this drug. But this drug, whether it's remdesivir or a number of other antivirals that were being used at that time, were just absolutely out of stock. And this is in one of the largest pharmaceutical markets in the world. And so they would spend days and weeks looking for these things and then were prey to all of the same, black markets and way overpriced medications. And at that time, at least, we did not have that good an indication that these medicines or treatments would actually do a lot for the patients in question. I thought it was a sad story, but it was also, unfortunately, a bit like the Wild Wild West, actually. There were people who were running on the merest hint of a rumor that a treatment was effective. And it was not just ordinary citizens. I think there were many hospitals and doctors who were doing the same.
I have two more questions for you. I don't want to take up too much of your time, but you're full of knowledge, so it's great to engage with you this way. I'm learning a lot too. Over here, you hear a lot of people are like, oh, well, we shouldn't ask drug companies to give up their intellectual property rights because that could set, a dangerous precedent for the future. And people over here, they're, very protective of that. And they view that as a way to make a lot of money, those patent protections. But, here we are in a pandemic. What would you say to those people who have that particular concern?
Firstly, intellectual property rights is a fancy way of saying monopoly. And the reason I prefer monopoly is that everybody understands a monopoly. And there are very few people on the receiving end of monopolies who would want one to exist, right? It's just not a human thing. If you're up against a monopoly, you don't want it to exist. It is widely considered to be a bad thing. We have entire antitrust laws and institutions that are created to regulate monopolies because monopolies are considered bad for humans and society. Look, the funny thing about intellectual property is that it is a state-sanctioned monopoly. So this is something that the state not only allows, but guarantees in effect. The logic of the monopoly is that private capital is put to risk in developing new drugs. And of course, this is a risky business. You can spend years researching something, make very small advances, and have it not result in a drug that can be brought to market. It's a circuitous process. You can work on lots of failed things. Those failed things can be expensive. It is like Edison inventing the light bulb, meaning that it's the basis of every drug that's brought to market, or every vaccine has a trail of failed vaccines and drugs in its wake leading up to it. Now, all of that is true. I think what is not as well understood is that in the United States, especially, the financial risk that these companies have taken to develop these drugs and vaccines has largely been borne by you, like literally you, right? The American taxpayer. So the National Institutes of Health, among other US institutions like BARDA and others, and like Warp Speed in the pandemic, have essentially been doling out billions of dollars of taxpayer money, not just in the pandemic, but right through since the 1980s or 1970s at the very least. And all of this money then goes into private hands and is never then accountable back to the public that it came from, right? And so what I mean is, it's one thing for me sitting here in Bangalore to say, oh, these vaccines, they were state funded by the United States and they should be public goods and we should have access to them. I think it's a whole other thing for you sitting in the United States to say, wait a minute, but I made these vaccines, I funded these vaccines. The funny thing is that I think Americans are so overjoyed that they're getting this for free, right? The vaccines are free. Of course, the vaccines are not free. You already paid for them once. You're surprised because you're not paying for them twice, like you normally are. This is the fact. I mean, this is the fact, right? It's just such a thrill not to pay for something twice that most Americans can't believe it. And some Americans don't trust it. But this is the fundamental truth about the American government and pharmaceutical industry that I think is not widely understood enough. In the pandemic, what happened was a curious rearrangement happened, right? So normally the US government actually hides the funding that it provides pharmaceutical companies. And I don't mean it tries to bury it. What I mean is that it actively tries to depublicize the role that government plays in private enterprise in the United States. And this is part of a larger set, right? We could get into that, but I think that, especially since the Reagan administration in the United States, there's this idea that if you're a government, in government, and it's working in some form to shape society or help it, you should be ashamed of that and try to hide it and give the credit to private enterprise instead, because that's the playbook, which is absurd in itself. But in the pandemic, what happened is that administrations like the Trump administration actually had to justify on television every single day what they were doing for their people. So not only did they not hide the fact that $1 billion went to Moderna, they were publicizing it. So that's why this is the first time we have such clear numbers of what the US administration did, because they had to. In the months leading up to a vaccine, they had to win the support of their people by telling them, this is what we're doing. So now we have all the numbers, and now we have all the figures, and it's astonishing. I mean, it's just astonishing. You know, the tens of billions that have gone to companies like Pfizer and Moderna, the billions that have gone to a company like J&J, not just to completely fund the research and development, right? Which means there's no risk. So there's no private capital, firstly, and there's no risk. If Moderna had failed at their vaccine project, how much would they have been liable for? That much. If Johnson & Johnson had failed at developing a vaccine, that's what their risk would have been at the end of the day, because it was funded. It was entirely funded. So this was a commissioned project. You pay somebody to build a home for you, right? And then when it works out and they actually manage to do that, you somehow have to negotiate a price to get the keys, to pay a monthly rent to that person to live in it. That is how absurd it is, right? So the situation with being the administration right now and having to talk to Moderna to say, hey, can you give us some more? Or do you think you can do something about the 75% of the world that you have not made any vaccines for and are refusing to share your technology with? It is like a homeowner negotiating with a contractor who they've commissioned to build a house for them to say, oh, I'm so happy you built this house with all the money that I gave you on the land that I own. And now, do you think I could have the keys? Or could I just stay there a little longer for 2 days instead of 1? That's how absurd it is, right? So the logic of monopolies has never actually held true. The logic of monopolies in the coronavirus pandemic, I think, is just frightful. It is an absurdity.
Thank you, Achal. One last question here. What would you say to, and somebody asked me this the other day about, we were talking about access to vaccines across the globe, and she said, what can I do? And, just people, everyday people going about their lives who feel like they don't really have much power to help here, but they're aware of the situation. And I think raising awareness is so important. Like hopefully this podcast is doing that, but how would you advise someone like that? Like, how could somebody help your cause?
I think the only way that we've got so far, I mean, the only reason that the Biden administration signaled support for the TRIPS waiver is as a result of the work that thousands of Americans did across the United States. And I used to speak to some of them, have to sit up, actually, unfortunately, until 1 and 2 in the morning to speak to citizens groups organizing on trade justice in Seattle, which has a horrendous time difference with Bangalore. But I've been on many of these calls. I know that there were thousands more calls that I wasn't on, where small groups of people in different communities across all of the states of the United States worked together to try to put pressure on their own elected officials, whether it was city officials or members of the House and the Senate, but they did that. They did that, and that is why the Biden administration signaled its support. The old aphorism, so that it's not like the White House, this White House, or any White House is just going to do something because it's the right thing to do, obviously. And this is not, it's not even being cynical, it's being realistic. They did this because among the many right things to do, it was the thing that they were getting signals from their electorate that they wanted to have done. So people take messages from voters very seriously. Elected officials take messages from their constituents very seriously. And I think this is what we can do. The United States genuinely has the power to vaccinate the world. It is the single most powerful country in this respect. Germany is a second, but it's the United States that has all the cards here. Yeah, almost all the cards. And they need to play them. And if people understood this, if people understood that we are keeping vaccine technologies from J&J, from Moderna, secret, we're not sharing them because the rights and privileges, this vast interlocking set of rules and laws that benefit corporations are so sacrosanct that we can't tamper with them even in the tiniest bit, even if it means saving hundreds of millions of lives, right? And that is really the trade-off that an ordinary American is confronting, that a corporation in their border that barely benefits them is while actively gouging them, also denying access to these vaccines to the rest of the world. And they can do something about it. And if they did, and if that built up into a groundswell, that would absolutely change the situation.
Thank you so much for taking time out of your day, or your night actually, to come on. I really appreciate it. And I wish you luck in all that you're doing. It was a fascinating discussion. And to our viewers, thank you so much for joining in. Love reading your comments, and hopefully you learned something from this as well. Thanks, Achal. Really appreciate it. And I will definitely keep track of your writings and stuff, and you know, hopefully things start moving in the right direction. Hopefully.
Thank you. It was just an absolute pleasure. I really appreciated the questions. I think you're spot on in getting to the heart of this. Good luck. Thank you.
Thanks so much. Bye-bye.